Hello everyone and welcome to my channel. I have been getting lots of feedback on the hand reflexology video that I did, and many of you seem to have a real interest in this. So I thought I would continue with this theme today. I have got a small injury on one of my fingers, so I can't actually treat anyone today. So instead, I'm going to do some hand mapping because I want to carry on doing some videos for you, and I thought that would be a useful way of getting these reflex points into my head so that when my injury does recover, I can go in and do some reflexology treatments. I've actually found an old study book which has some really clearer hand reflexology pictures, much clearer than the ones that I've seen before. So what I'd like to do is have a look at some of these, looking at the palm of the hand first. So this is your left palm here, and I'll look at some of these areas which are quite clearly labelled here, and we'll look at those in a bit more detail. So that's the left palm, and then we've got the right palm here as well, which we'll look at in a little bit more detail. Okay, and once we've looked at the palms, what I want to do then is look at the top of the hand, which we know as the dorsal, and look at the areas that are covered on the top of the hand. So this is your left dorsal, and this is your right dorsal over here, which we'll look at in a little bit more detail. So one of the ways of looking at this is either you can, if you're trying to get it into your own head to do self-reflexology, is to use a little stick or a pointer. Got a stick like that which is suitable. Another tool that I do have is a pointer, which you can use as well, but I actually find a stick is quite light and you can pinpoint things quite easily. So we can literally work our way around the palm of the left hand, covering some of these areas. I'm going to roughly get some of these areas into my head so that I am familiar with them. So at the beginning here we've got the ovaries and obviously the testes in a male, and then going along here across the thumb here we've got the neck and the thyroid. Then along the spinal column at the top of the thumb here you've got the brain, the pituitary on the inside of the thumb here, and then we can go around to the top of the fingers where you've got the sinuses. Then coming down, got the eyes, and obviously you would use your reflex technique to really push on these areas and stimulate these areas to create energy to flow through these areas and release any blockages. Here we've got the ear. Then along here you would work the shoulders. And just as an example of one of the moves, this is called a walking move. So you would do that. I'm doing it at slow speed, but you would probably do it faster in your reflexology moves. So that would be the shoulders. Next here you've got the spleen, and underneath that the pancreas. Then you've got the stomach area here, and the solar plexus here, which is your energy centre. And that one you could put quite a lot of pressure on to release any blockages there. That does get blocked. Then coming down to here, you've got the pelvic areas around here, and then you've got the prostrate and the uterus, not together, but prostrate or uterus there. Right, okay, we're going to move on to the right palm now, and obviously there will be some similar things, but there will equally be some different areas of the body on here. Right, okay, so you will start with the testes or ovaries here and the pelvic area, so very similar to the other side. Then on this side you've got the gallbladder here, just on this side. You've got the solar plexus again, and the liver. There you've got the shoulder, and again the ear, the eye. Then down in here the throat area, and then coming down you've got the adrenal area, the kidneys, the bladder, and the prostrate or uterus there. I'm going to move the book slightly over so that we can get the dorsal images into the picture a bit more. Now we're going to look at the dorsal side of the hand. So we'll look at the right one first. So here you've got the spinal column along here. You've got the lymph drainage here. You've got a very large chest area here. Then you've got the shoulder and the breast area here. Going down to the lymphatics at the bottom, the fallopian tubes just above that, and then the lower pelvic area here. And that's the right dorsal. Okay, right, we're just going to look now at the dorsal on the left hand side. So we're going to start over here on the thumb with the cervical area and the thoracic area, and then the lumbar sacrum, the lower pelvic area, which is this large area here, again the fallopians, the lymphatic area. Then on the edge here you've got the knee, leg, hip, the lower back area that you would work here. Then you've got the arm just here, the shoulder, and then you've got the ears and the eyes, similar to the other side. And for those of you that are eagle-eyed, you'll see that this particular picture starts talking about meridian lines, which we're not going to go into today. We can talk about those another day. But if you're interested, there you can see some of the names of them there. There are 14 meridians altogether in the body, and there is quite a lot of crossover between acupressure, which are along the meridian lines, and reflex points. And I suspect that's why they've got it in the diagram here. But you've got some of the main meridians talked about here: the small intestine, the heart, the circulation meridian, the endocrine meridian here, the large intestine, and the lung meridian, which are some of the main meridian channels discussed. But as I said, we'll look at that another day. So I'm going to start this self-reflex routine by working the lung and breast area. So gently walking along these areas, and then do the same on the other side. Right, okay, so we're going to continue working the breast and the lung area on the top part of the hand. Then what we're going to do is work the heart, but that is on the left hand only. So using the right thumb, we'll work over the heart area on the left palm. And I'm only doing these movements once, but generally you would do them 2 to 3 times. So then 4 is work the sinuses. So work the right hand first, using the left thumb to work the reflex points down the length of the thumb, and then all of the fingers. Miss out that one. It helps to clear the sinuses and any problems with that area. Then you would work the eye just by pushing in. So on number 6, working the neck, thyroid and throat. With the left thumb, work the thyroid reflexes, which form a ring around the base of the thumb. Then working the coccyx, hip and pelvis. You use the 4 fingers of your left hand to apply pressure to the outer edge of your right hand. Start on the lower edge, then edge up the side to contact the reflexes for the hip and pelvis at the top of the hand. So we're now working the coccyx, hip and pelvis, so using the 4 fingers of the left hand to apply pressure to the outside edge of your right hand. Start at the lower edge to contact the coccyx, then edge up the side to the hip and pelvis area at the top of the hand, and then repeat. this one as well. Then we work up the spine. Oh, I could feel that. Then working the brain, use your left thumb to work the top of the right thumb where the brain is. Apply pressure, hold it for 5 seconds and then release, and then we'll just do it once, but you do that 3 times. Then do that on your left hand. Use the left thumb to work across the right thumb, starting below the nail and following the lines. Okay, so we're working the face and teeth. So using your left thumb, work across the right thumb. And do the same on the other side. Releases any blockages in that area. Then we're working the shoulder, just this area here. And often you can feel in this area a little bit of crunchiness, which is the toxin build-up of lactic acid. Then do the same on the left side. Those shoulder areas. So working the knee and elbow. Just work that outside area. And do the same on the other side. Then we'll move on to work the liver and gallbladder. The reflexes for these are only on the right hand. So you use your left thumb to work the area that's indicated here, which is sort of level with the thumb. And you would do that so that you cover that area. So you cover the liver and the gallbladder. So probably covering 3 lines there. Then you would move on to work the stomach, the pancreas, the spleen, and the solar plexus. So the reflexes for the stomach, pancreas, spleen, and solar plexus are on the left hand only. So you use your right thumb just to cover those. So then we work the intestines. So using your left thumb to work the area. Covering the colon and the small intestine. Then you work the bladder and the urethra, just this area here. then the kidneys, which when you're practiced you can actually locate and feel. Then you can work the uterus with the left thumb. A slight, what they call a hooking move here. Then the ovary and groin area. And then very last is working the fallopian, which is to the bottom, as we indicated at the very beginning of the video. And that brings us to the end of my first go at a self-reflex routine that I have not done for many years. It's not perfect, but actually it's really interesting to look again at some of these moves. Some of them need refining, I think, but on the whole I got a really much better idea. So thank you for coming on that journey with me today. Hello everyone, and welcome to my channel. Today I'm going to talk to you about self-care, and in particular focus on hand care using a paraffin wax pot. I was in my loft a few weeks ago and came across some of the equipment that I used to use in my old treatment room, and I found my old paraffin wax pot. I used to use this for manicures and pedicure treatments and for pain relief, which I'll talk to you about a little bit later. For those of you in the UK that might remember a high street store called Woolworths, I remember purchasing this from that store, which is obviously no longer with us. But I remember it with fondness. I bought a number of my products from that store, and it just gave me a few ideas that I could hopefully share with you and share how I used it many years ago. So one of the things I want to talk about at the beginning of this treatment is the benefits of paraffin wax baths, as they're called. And these can be used for both cosmetic and therapeutic benefits. Cosmetically, paraffin wax is often applied to the hands and the feet. The wax itself is a natural emollient, so it helps to make the skin supple and soft. And when it's applied to the skin, it adds in moisture. It can also help to open up pores and remove dead skin cells, and then it leaves the skin looking fresher and really feeling quite soft and smooth. It can be included as part of another treatment, and indeed I used to include it as part of a hand or foot massage or an advanced manicure or pedicure. So looking at the other side, which is the therapeutic benefits, paraffin wax can be used to help relieve pain in the hands of people who suffer from things like osteoarthritis, rheumatoid arthritis, fibromyalgia, and other joint mobility issues as well it can help with. The reason for this is that it acts as a form of heat therapy and can help to increase blood flow in those areas, really relax the muscles in those areas, and really help with joint stiffness. The paraffin wax is tested in a laboratory to make sure that it is safe and hygienic to use, and it's completely natural and has a low melting point. Now that means it can be easily applied to the skin at a temperature that is low enough to not cause burns or blisters. You do need to be very careful with it. Wax needs to be very carefully handled, so always follow the manufacturer's guidelines and always buy your wax, your paraffin wax, from a reputable source. You should not use paraffin wax if you have things like poor blood circulation, numbness in your hands or feet, because you won't be able to feel the depth of the heat, diabetes, or any rashes or open sores. And a good therapist will check all of this before they allow you anywhere near the wax. In the UK, this treatment is used in many hospitals of the NHS, particularly in the physiotherapy sections. So if it is used with care, it can help with pain relief. However, you must always consult with your medical practitioner before you decide to do that. So let's take our paraffin wax and add it to the wax bath. You can purchase wax in different forms. One form is as a block, such as this, which is unscented, which you can pop in. But you know me, any opportunity to add an aromatherapy oil, and I must say I prefer to use wax pellets such as these ones, and this one has tea tree and peppermint already in it. So what I'm going to do now is open this bag and put the wax pellets into the paraffin wax bath. So I'm going to open the bag now. And we are going to use the whole bag. Just going to pop this in. The smell is already incredible, and actually the uplifting nature of those two oils will add to the overall atmosphere of relaxation and a sense overall of well-being. So the wax bath, which I'm going to turn on now, will take about 3 hours to heat up. So you do have to plan ahead if you're doing this treatment on yourself. So once this has melted and fully melted, I will check and show it to you once it's in its melted form, and I'll rejoin you once it's actually ready. Hello and welcome back to this video on self-hand care using a wax pot. The wax in the pot has been melting for around about 3 hours, and for the last hour I've turned the dial right down. This is so that the wax is not too hot to use, and you can see already that the wax pellets have completely melted. And I've put a grate in the bottom so that if you do touch the bottom, it's not going to be too hot on your hands. And that also helps to contain any impurities that fall to the bottom of the pot so that you can clean it out afterwards. One thing to be wary of when you're dealing with wax is that it can get very messy. So you can see I've already got some plastic here covering the towel that I've got, and the towel is covering the table, and that's deliberate because wax can get everywhere. And what you want to make sure of is that you have everything that you could possibly need to hand and within reach, because once you start getting wax on your hands, then it becomes a little bit challenging to do certain things. So one of the first things I do want to do is wash my hands. So I've got a bowl of warm water here, and following on from the tea tree theme that's already in the wax, I thought I would put a couple of drops of tea tree oil . So if you add that to the warm water, and that will diffuse, and the smell adds to the overall atmosphere of cleansing and nourishing. So literally just want to make sure that my hands are scrupulously clean before I progress. So after I've washed and dried my hands, what I tend to do is just give myself a quick check over for contraindications. And again, if you're having this treatment done on you, obviously a good therapist would check for any contraindications first. So in particular, what you are looking for is any cuts or bruises or open sores in particular that you might not have picked up just by glancing at your hands. So it's always worth just giving them a little check just to make sure that there are no contraindications at all. And it's surprising what can actually cause you problems with this. So things, for example, like paper cuts can be a little bit sore, so you don't really want those. But you need to make your own judgment call as to whether they're severe enough to stop the treatment. Or the other things, and I do get these on the edges of my nails, is rag nails, which if you've torn for any reason can be a little bit painful when they hit the hot wax. So again, you need to make a judgment call on that one. But generally, my hands are good to go. What you can also do is add a cream to your hands, and that's primarily because it helps you to remove the wax later in a much more easier way. But generally I don't find I need that, and once I have my hand in the plastic bag I'll show you later, the wax seems to come off quite easily, but it is there if you need it. The other thing I would strongly advise you to do is to do a last minute temperature check. And the way you do this is just to dip in and just test here to see if the wax temperature is sufficiently cooled down enough for you to do the treatment. And that's absolutely fine. You can just rub that off. You can see it's coming here, which is why I've protected the table. So as I said, especially when it's crumbly like that, it can get everywhere. So there are two methods that you can use, and I will demonstrate both methods, one on one hand and one on the other. You're aiming for 6 to 10 layers of wax to really cover the hand. If you only do one layer, it becomes too thin and it will become very crumbly. What you're looking for is a smooth build-up of layers, and then the wax will retain the heat and also will come off much more easily in one go. Now, some people prefer to do both hands at the same time. When I'm doing this on myself for self-care, I find that's quite challenging to do. So I look upon this as a little bit of me time. If I've prepared enough, I can do a little bit of wind down time after work, and that way I work on one hand first, and then I go and have a little bit of a relax while the heat is penetrating through the wax into my hand, keeping it nice and warm. And then I'll go and read a book or do something else that relaxes me, or just literally sit and chill for 15 minutes or so. Then I'll take the wax off that hand and I'll then do the other hand in the same way. So the first method I'm going to show you is what we call the brushing method, exactly as it says. So you literally dip a wax brush in and you literally start building up the layers on your hand. Now, if obviously the wax is too hot for you at this point, do immediately stop and turn the dial down. You wait till that's cooled. And then you go again. I find this quite relaxing. And you keep going like this till you've got 6 to 10 layers, I think is the norm for it to penetrate the warmth into your hand. Right, I think we're at number 4, aren't we? And you can see how it slowly builds up the layers. Okay. next layer's that. Make sure you've got somewhere to put your brush down. And then, so that we keep this warm, we'll pop the lid on. Now your next stage is to make sure that you've got some plastic sheeting. These often come with the product, but you can buy them separately as well. Some people have plastic gloves which fit over the fingers as well. I find those quite fiddly. So I find the plastic bags much more easily to manage. And also you can see clearly how your hand fits in there. And you can feel the warmth of the wax going into the hand. Now, just to add some added warmth, you can buy some special gloves and mittens that go over the top of this as well, really just to keep your hand nice and warm and add to the warmth while you're relaxing. And once that's ready, I would suggest you go away and just relax for 15 minutes. As you can see, I find it quite difficult if you're now expected to do the other hand. People do, because I'm about to dip in and show you, prefer to do it that way. But as I said, I find that challenging, so I prefer to do it this way. And I don't mind stopping and going off and relaxing. Now, obviously, normally you would go away for 15 minutes and relax, but just in the interest of the video, I'm going to remove this because I think it's cooled down enough for me to remove it. So just for the purposes of the demonstration. And obviously, because it's clear plastic, you can see how easily the wax actually does come off. Here you go. Pop that to one side. And you can already feel that your hand is much softer than the one that you haven't done. Okay, so now we're going to move on to the second method that some people prefer. And this involves you putting your whole hand in and taking it out. You only need to go in quickly and dip it in. Just wait till it cools, that's the second one, and just slowly layer up as you do this. Once again, make sure that the temperature is comfortable for you, that you've turned the dial right down. Yep. And for those that are using this for a heat treatment, obviously just make sure that you have spoken to your medical practitioner. Indeed, you really need advice on the best wax pot to use for your particular condition so that you do the right thing. And particularly if it's a home treatment, you want to make absolutely sure that you're doing everything right. So you can see it builds up quite quickly. That's a quick dip in and out. Doesn't take long to build up. Now I'm sitting down for demonstration reasons, but you might find it easier to stand up and dip in, whatever is comfortable for you. Just be aware these wax pots are very light, so you need to be very careful when you're pushing down that you don't push the bowl over. That's the last one. And again, you can do what you did on the other side. Pop the plastic on and that will retain the warmth and the heat. You can again put the mitten on, which will give it some added warmth, and then go off and continue to read your book or relax. Just have a little bit of chill time. I've got a little reading nook in my bedroom where I just like to relax and chill and read either a book or on my Kindle and just switch off. Particularly if I've had a hard day at work, this is a way of me just switching off and having some warm treatment and really having an impact on my skin, which as I've got older has become very dry, and I find this really hydrates the skin well. And 15 minutes should be long enough for the wax to have cooled down so that it's easier to take off. Right, obviously you would take 15 minutes, but it's possibly cooled down enough for the demonstration that we can actually, again, pull off the wax. There we go, you can feel how smooth that has worked. There we go. Now the wax that I've just taken off, you can, if you want to, just bin that. The wax that is in the pot can be reused if it's just you and it looks clear. If there's the slightest element of impurities in there, then obviously pop the wax into a plastic bag. Be very careful when you pour it, and it will harden, and then you can pop that in the bin. If you're using this on clients, obviously you can't reuse the wax. Some manufacturers do provide you with bags that you can put the wax in, which makes it easier to remove. But once the wax hardens after it cools down, it's impossible to get it out of the pot, so you need to put it into something else while it is still in a melted form. So one of the other things at the end that is always advisable to do is you want to retain that moisture that you've got in the hands. So one of the things to do is to take something like a coconut oil, carrot oil, and just rub that over the hands, and that will help to retain the moisture that you've got in the hands. It will also take off any remaining residue of that wax. Okay, that's the end of the treatment today, and hopefully I've introduced you into the possibility of self-care with a wax pot. Obviously, reading the manufacturer's instructions and being cautious with that. But if this is something that works for you, then by all means you can see how straightforward it is to use. And thank you for sharing in one of my old finds that I found up in the attic, and it's still working well today. So I'm happy to share that experience with you. Thank you. Hello everyone, and welcome to my channel. I often get asked if there are any therapies that can be done effectively on yourself. Hand reflexology is certainly one of these. And today I would like to introduce you to hand reflexology, some of the techniques that can be used, and a basic routine. Hand reflexology is a relaxing treatment that helps you unwind at times of stress and anxiety. Many of you will have heard of foot reflexology, but if you've got a foot injury, or indeed if you've got ticklish feet, or if you find trying to do foot reflexology quite uncomfortable, then hand reflexology is a very good alternative. And some people just prefer working on the hands to the feet. Reflexology is about treating the whole person. That feel-good factor can have a major impact on people's overall sense of well-being. And the idea today is just to provide you with a little glimpse into this therapy. Hopefully, if it stimulates your interest, you can take it to the next level, research it a little bit more, or indeed think about becoming a reflexologist yourself. I recently came across a diagram in a hand reflexology book that I was reading. I've got this book here, and it's by Stephanie Sabushian, and she's the Vice President of the World Reflexology Foundation and serves on the Board of Directors of the Reflexology Association of America. So very experienced reflexologist. And when I was going through the introductory part of the book, I came across this diagram, which really helps to explain the idea and the links between the body and the hand. So she has a very clear diagram here of the body, which she has divided into 6 regions. And they correspond in colour coordination across to the hands. So here, for example, at the top, you have this purple colour, which refers to the head and the neck of the body. And in her diagram, she corresponds across to that area that links to the left palm of the hand and the left back. So as you go down the body, she labels the corresponding parts, and it's a very visual way of understanding what hand reflexology is about. And I found it a very helpful visual to start with, and we'll be coming back to this book at various times over the course of the video. So before we get into talking about some basic techniques and moving forward to an actual routine, we need to think about preparing for the actual treatment. So obviously the first thing to do is begin with washing your hands. And as always, I'm going to put a drop of aromatherapy oil. This is just lavender. It's a wonderful smell already diffusing from that. So I'm just going to make sure that I rinse my hands. Oh, I just find that really helps to relax your hands as well. The water is slightly warm, so it's very welcoming. Just pop this to one side for now. So what I'm going to do next is just inspect my hands as I normally would on any treatment with a client. And it's useful if you're checking your own hands, because sometimes you can't pick up things like bruises or cuts, which might cause a contraindication and cause you pain while you're doing reflexology treatments. So it's certainly worth just giving your hands a quick once over with the magnifying glass, just to check for anything that might prevent you from doing a treatment. And you're looking in particular for things like bruising or cuts. Sometimes you just get little paper cuts from normal everyday usage, and it's useful to know that they're there. Doesn't always mean that you have to stop the treatment, but it is useful to know, especially if something is very tender. You might want to work around that particular area. So that is all okay, and we are good to go. So after you've relaxed by cleaning your hands, the next stage is to try and do some basic relaxation moves. So we have a few that I can suggest, but there are many from other books that are suggested, but these are the ones that I like to use. And the first one is a little rocking move like this, sometimes called the sandwich. And while you're doing this, you could take some deep breaths as well, just so that you can relax yourself a bit more. Remember, this is all about self-care. Then maybe a little bit of wrist rotation here. Maybe some finger pulls, just to loosen that up so it's nice and relaxed when you come to do your reflexology moves. And another nice one is doing a little bit of a roll. Various names given to this one, could be fist on palm, but I just call it a fist roll. There's a nice area in there that you want to really relax. Now, some people might want to pop a pillow here so that your hand is nice and relaxed, or a towel. Just for the purposes of demonstration, I'm not going to do that because it tends to merge into your hand and you don't get to see everything. But that might be quite nice to get you more relaxed for the treatment. The next stage is to become familiar with some of the basic techniques of reflexology. And I will be using Stephanie Sabushian's book to guide me through some of those basic moves. I use these clips just to hold the pages back. Tip I got from a friend ages ago: if you're looking at some of these textbooks, they tend to fold up as you're trying to read. So these are actually old hair grips. So useful tip there, just to keep that side down, and then you can clip it under as you go along. So one of the first moves that Stephanie suggests you get used to is something called the thumb roll. And I'm going to use her diagrams here, which are very clear. So she said this is the main reflexology technique that can be used on most surfaces of the hand. It's a high thumb roll. So you're looking for the thumb to move quite freely across there. Now I'm doing this quite slowly. In reflexology, you would actually do it quite quickly like this. Some people refer to this as the caterpillar move, and it is the one that you use the most. Your thumbs are actually much stronger than your fingers, so and you do strengthen them when you do reflexology, but walking like this, she calls the thumb roll. What I also like about her book is she's got some wonderful little hints and suggestions. So one thing here is about hydration. It's important to hydrate before and after reflexology sessions to flush the system of any impurities. And I think when you are working on the energy pathways of the body, you can dehydrate quite easily. So make sure that you've got some water to hand and do hydrate when you need to. Now, a couple of the other diagrams she's got here is where the thumb roll that she's talking about can be made slightly higher when the depth needs to go in a little bit more. So you roll up to the tip of your thumb and put a little bit more emphasis there. So you've got the general one, and then you've got one that's a little bit higher that adds more depth. So let's move on to one of the other moves that she's suggesting here. And this is a finger roll. So similar to the thumb roll, the finger roll is useful on the back of the thumb and fingers and for reflexing in the grooves between the long bones on the back of the hand. So place the pad of your index finger onto the tissue and apply gentle pressure. Maintaining that gentle pressure, start bending the finger at the joint below the nail and roll all the way up onto the tip of your index finger. Then come back to your starting position with the pad of your finger on the tissue. It does say here another hint. When using the finger roll, keep in mind that the joints of the fingers are not as strong as the thumb joints, so do not overuse the index finger. Her next move is a two-finger roll, and the two-finger roll is mostly used on the back of the fingers and on the wrist as well. So place the tips of your index and middle fingers next to each other on the tissue, so like this, and apply gentle pressure. And maintaining that same pressure, bend both fingers at the joint below the nail and roll up onto the tips of your index and middle fingers, and then come back to the starting position with the pad of your finger on the tissue. So that would be your two-finger roll. And then we also have a 3-finger roll. So that's on this hand. And then you're applying pressure. And then bend the fingers and roll away. Then another technique is the hold and rotate technique. This technique can be used anywhere on the palm of your hand. It can help calm reflex areas when they are too sensitive to be worked on with the thumb or finger rolls. Place the pad of your working thumb on the tissue, apply gentle pressure and hold for a few minutes. And then maintaining the same pressure, start slow circular movements. Make sure you don't slide on the skin, but simply move the skin underneath your thumb. So you're just moving rather than moving across it. Then we have something called the web squeeze. Now, the web squeeze is exactly what it says. You have various webs in between these fingers. You have the main one here, and you would literally squeeze this area very gently and hold the web that you see there between the thumb and finger. So you've got thumb there, finger there. Now, there is a cautionary note here. So if you are pregnant, do not squeeze the big web, which is this one. You can, however, safely reflex the small webs as described below. So place the tip of the index finger in the small web on the back of the hand between 2 fingers, like that. Or you can go underneath like that. And then you have the final basic technique, which is called the hold and stretch technique. So you use this technique when working in the grooves between the long bones on the back of the hand. So basically like this. You can do that with 3 fingers as well. And those are the basic techniques that Stephanie is suggesting we use throughout her routine, which we will get to shortly. So in her book, she does set out a full routine. What I really like about this book is that she's not using a model to work on, or the book isn't written as though you're working on your partner. The book is designed for self-care, so very much aimed at you learning how to do this yourself and how to treat yourself. So do follow me in a moment as I work through her suggested moves. So before we move towards doing a routine, I just want to talk to you a little bit about reflexology. So reflexology, like many Eastern therapies, is largely about unblocking the energy lines and increasing that flow of chi and stimulating your body's own healing mechanism. Some studies in the last decade have looked at its benefits, particularly some studies in Denmark and the United States, with some evidential success. But we are a long way off completion of clinical evidential studies, and much of the evidence is still anecdotal. Therefore, reflexologists do not diagnose illness or practice medicine. And if you are suffering from a chronic illness or you are medically being treated, then I would suggest that you consult your medical practitioner first. And particularly if you are pregnant, you may want to leave this till after the first trimester. What reflexologists do, however, is study the body's systems, and they familiarise themselves with the physiology of the hands and the feet. So if you are planning to do reflexology, please do some research and enjoy reading about the benefits of a little me time, taking time out to do that research, really by looking at some of these holistic therapies. Now, normally when we do a treatment, I would use something like aromatherapy oils, but in this instance, this is one treatment where you don't want to put loads of oil on the hands because you need to be able to grip the skin and areas of the hands. But if you want to, you could use a cream or a cornstarch, or there are some new reflexology waxes that allow you still to have that grip where you need to work through the reflex points. But you certainly don't want the hands to be covered in oil as you need to maintain that contact. Positive touch during reflexology stimulates the release of oxytocin, encouraging relaxation, and regular treatments can help you feel calmer and even improve your sleep. But this will require a number of treatments. Self-care approaches like this can put you in control of your ability to manage stress and increase relaxation, and can be quite empowering, creating a much more positive frame of mind. So with that in mind, what we're going to move to now is the full routine that Stephanie is suggesting we do. So I'll just read through her introduction here. She says, applied regularly, this simple but powerful hand reflexology routine can help boost your immune system and keep away little aches and pains. The routine works through 6 regions of the hands, and once you have practiced each region, you can combine all the steps into a flowing routine for both hands that takes less than 20 minutes to complete. What I really like is the way that she has put this together. The first page, with regard to this particular region, which is the head and neck region, gives you a little bit of information about that. So here we've got the fingers and thumbs represent the head and neck region in the body. And again, useful visuals there. And then she goes on to take us through the basic routine using visuals. I have not done this routine yet because I really wanted this to be an honest learning experience that I share with you. So I'm going to walk through this and follow her guidance and share that experience with you. So obviously one of the first things we're going to do is work on one hand, and I'm going to use my worker hand, which is the right hand because that's my dominant hand, and I'm going to work along the left hand. What you would do normally is work the left hand and then switch over and do the right hand, but I'm just going to demonstrate walking through the routine on the left hand. Now I think it's personal choice. You can switch constantly, or you can do the left hand first and then move on to the right. I think it's entirely up to you. But obviously the key thing here is for you to become familiar with her techniques, what she's suggesting, and a routine. I have come across other routines. Louise Keat, for example, is one of my favourite reflexologists, and she does a routine as well. And Anne Jalanders is another one that I have used. But again, their routine is a little different because it's done through modelling and partnering. And with Stephanie, she even calls this a practice for promoting self-care. So let's see if this actually works for us. So I'm literally going to now work my way through her routine. So let's look at the first diagram here. With the palm up, place the fingers of the working hand underneath the fingers of the hand being reflexed. Begin a thumb roll at the top of the index finger, working towards the palm until you reach the base of the finger. So we'll do that now. And then repeat on both sides of the index finger. So we'll do to the side of that, and we'll do on the other side. And if you get lost, there are some very clear directional arrows as to the direction you should be going in and the area that you should be covering, and you simply do that on the other fingers using that. So I call it the caterpillar move. She's calling it a thumb roll. Right, and the next diagram, turn the hand over, place the thumb of the working hand under the index finger, use a 2-finger roll to reflex from the nail bed to the base of the finger. Actually, it's easier if you tuck those fingers out the way. Repeat to the middle, the ring, and the little finger. And then you can decide to do it on the other hand or not. Then we've got place the thumb to be reflexed palm side up on 4 fingers of the working hand for support. Okay, so 4 fingers underneath the thumb. Begin a thumb roll from the top of the thumb horizontally across the surface of the thumb. Lift off and repeat the action, working downwards towards the palm. And then we're turning the hand over to reflex the nail side of the thumb. Place the thumb pad on the 4 fingers of the working hand and then use a thumb roll across the surface. So start at the nail. Then go down to the knuckle. There we go. And as I said, if you lose your place or you don't understand some of the things she's referring to, it's very, very clear from the diagram. I am actually liking this routine. So that's interesting. That's working quite well. So the next region is the chest region. So the knuckles below the thumb and fingers here represent the chest region in the body. So let's look at doing those now. So you're resting your fingers underneath the hand that you're doing your reflex moves on. And again, you're using that caterpillar move and you're covering this area. And then you're working vertically upwards to cover this area. And then she's suggesting we use the thumb roll on the palm side of the knuckle between the thumb and the palm, working from the diaphragm line upwards to the shoulder line. I don't find that easy to do, actually. I think I'm going to go in this way. Maybe I've got shorter fingers. Yeah, I'm going to have to do that. I can't do that. Maybe that would take a little bit of practice to get over there. I think I'd prefer to do it that way, adapt. And then this one is with the fingers of the working hand on the back of the thumb being reflexed. Use a thumb roll sideways, reflexing the palm side of the thumb. There we go. So slightly lower down the thumb that you were doing earlier. So in the slightly fleshy part of your thumb. So you're edging from the edge of the thumb underneath that area into the palm. Yep, that works. Ooh, this is a slightly longer one. So to reflex the back of the thumb knuckle, place the index and middle fingers of the working hand behind the thumb being reflexed. Work a thumb roll horizontally across the knuckle. Work with light pressure and reflex gently over any tendons. Then use a thumb roll to reflex the knuckle vertically now. Start at the shoulder line and working towards the diaphragm line. Okay, so you're starting sort of halfway down the thumb, covering that area there. Then we're working the small webs between the fingers. Okay. Okay. Between the little finger and the ring finger. And then reflexing towards the fingers. So I think that's more of a move between there rather than what I'm doing, which is a sort of hook move. So I've got that slightly wrong. So let's do that again. Repeat. Yeah. So you're actually moving to cover these webs. And then use the index and middle fingers to hold and stretch each of the grooves. Oh, that's an interesting one. So coming round this way. So to hold and stretch each of the grooves between the long bones on the back of the hand. Oh, this was like this 2-finger rolls and sets. Place the thumb of your working hand on the palm for support. Use gentle pressure and slow stretches. Repeat the stretch in each groove several times. Right, so I get that. So it's the grooves. I've got very narrow ones, but it is this groove in between that you're pulling to hold that hold and stretch move. Oh, that was quite interesting. And then the next region is the upper and mid abdomen region, and that covers quite a lot of the area of the middle part of the body. So let's move on to that one now. So we've got, so we're moving down from the head chest area into the abdomen area. So place your thumb below the knuckle under the little finger on the palm side. Support the back of the hand with the fingers of the working hand. Thumb roll across the palm to the opposite edge. Repeat a few times to help relax the diaphragm, and then continue to make horizontal passes, working down a little with each pass until you reach the pelvic line at the heel of the hand. Okay. And then we're working a thumb roll upwards between the pelvic line and the diaphragm line. So start just above the heel of your hand on the outer edge and roll up until you reach the knuckles. So with each vertical pass, work a little closer to the thumb until you have reached the big web between the index and thumb finger. So turn the hand and place the thumb of the working hand in the big web close to the bone of the index finger. So that's this one here at the base of the thumb. Place the tip of the index finger on the opposite side, so that's that one, and squeeze the web gently between finger and thumb. Roll the thumb and index finger upward until you reach the web, the end of the big web, and repeat that several times. And then reflex the back of the hand below the knuckles with a 3-finger roll. So place the tips of the index, middle and ring fingers at the outer edge of the hand, being reflexed just below the knuckles, and then roll the fingers. Oh, you're going to have to hold your hand up to do that, actually. Obviously, if you were on a pillow, that would make it much easier. Although she's not stating this, I would instinctively want to do 3 passes of all of these moves. Okay, so the next region is the lower abdomen and the pelvic region. So the heels of the hands represent the lower abdomen and the pelvic region. So you can read a little bit about that, but we're going to go straight in to do the routine across here. So with the fingers of the working hand on the back of the hand for support, place the thumb at the pelvic line where the palm meets the heel of the hand under the little finger. There we go. So level with that and across there. Work a thumb roll horizontally across the surface until you reach the opposite edge of the hand, and repeat the action at intervals until you reach the wrist. And then place the working thumb on the wrist, okay, below the little finger, with the fingers behind the wrist and hand for support. Have automatically done that. So use a thumb roll to reflex upward until you reach the pelvic line, which is where you started before. Repeat the action at intervals with each pass, working a little closer to the thumb. Okay, and then we've got reflex the wrist with a 2-finger roll on the back of the hand. Place the working index and ring fingers next to each other on the wrist at the edge of the hand, under the little finger, and roll all the way across. Oh, I think that's further down actually, all the way across to the opposite edge. Right, then we have the midline and spinal region. So the edge of the hand just inside the thumb bone represents the midline and spinal region. So we're moving to the midline and the spinal region, and the edge of the hand just inside the thumb bone represents the midline and spinal region of the body. So let's look at what we're covering there. So we're literally working along this thumb line. Right, if you feel tenderness at any point, hold and rotate gently on the sore area for a couple of minutes or until the tenderness eases before moving on. So if you get any tenderness in that area, obviously this is along the spinal area, so if you've got tenderness there, you might find that you've got tender points along here. What she's suggesting is just hold and rotate if you have any tenderness along that. And then place the working thumb on the inside edge of the thumb being reflexed at the nail bed. Thumb roll down to the knuckle between the thumb and the palm. And again, she says repeat the action several times. I would suggest 3 in number to start you off until you get used to the routine. And then if you feel like taking it up past 3, then do that. Okay, so let's move. I think this might be this final region. So let's move to the arm and leg region. So the edge of the hands between the wrists and the little fingers represent the reflexes for the shoulder joints, the arms, the elbows, the wrists and hands, as well as the hips, legs, knees, ankles and feet, and ovaries in women and testes in men. So let's look at how she's covering this. So place the thumb on the outer edge of the hand, close to the wrist, under the little finger. here. Wrap the fingers of the working hand around the wrist for support and thumb roll up just over the slight protrusion above the wrist, about 1/3 of the way up the edge, working the leg reflexes. So just this small area here. So now point the tip of the working thumb towards the palm. Bend the thumb to a high roll and pause. You are now on the knee reflex. So pause in this position or make small circular motions for 1 minute. So to work the arm reflexes, start a thumb roll at the wrist again and work all the way up until you reach the base of the little finger, and repeat this several times. Finish by working just a small area directly below the base of the little finger to help relax the shoulder joint, and I can feel that. I do suffer with shoulder issues, and I can really feel that. There we go. Okay, interesting. Right, and I believe that takes us to the end of the routine that Stephanie is taking us through. I actually quite enjoyed that. I'm quite enthusiastic to go through this, and it's a very clear self-care routine. Now, obviously, what you would do is you would work your way through the routine, but you do your left hand first and then you do your right hand. So you could go back and do the whole routine on your right hand in this instance, working with your left hand. But I think we've got the general idea of this. I'm really pleased to be sharing this with you. I'm quite excited to find a routine that I'm very comfortable with and is very focused on self-care. Okay, so that brings us to the end of the routine. And just to finish off, what I'd like to do is just some more relaxation moves. So you can do the similar moves that we did at the start, such as the wrist rocking. You could do some finger rotations, as we did before. You could do some wrist drainage moves or some wrist rotations. And then also what would be good is just to do a solar plexus push in, just to clear that at the end. And then one thing I would suggest is, because we didn't put any oil at the beginning, what you might find is that your hands get a little bit dry. So it might be worth just putting a little bit of maybe a carrier oil. I've got a tiny bit of coconut oil here. Just rubbing that over your hands. We'll just take that dryness away. Make sure you do get into your palms here as well. Actually, that feels nice to give it a little bit of a palm move there. And then to finish, I will probably do some deep breathing as well. So I hope you've enjoyed sharing that new experience with me of this new routine that I've discovered. Thank you for sharing this experience with me.